Good afternoon and welcome everyone. Thank you for joining us for today's webinar on self-acupressure for stress management. My name is Molly Buss and I'm the Community Relations Manager at the Earl E. Bakken Center for Spirituality and Healing. And my role for this webinar is to moderate the chat. Please feel free to introduce yourself in the chat as you get settled. You're welcome to share where you're joining us from or perhaps what you're excited to learn about today. I wanted to give a quick introduction of the Bakken Center for those that may not be familiar with our work. It is our vision to advance the health and well-being of individuals, organizations, and communities through integrative health and healing. And during the COVID-19 pandemic, we have strived to provide free resources and webinars to help you navigate these challenging times. We do need your help to continue to do this work. So if you're able to, please consider making a donation of any amount, and more information about how to do that will be provided in the post-webinar email. Today, I'm delighted to introduce Dr. Mary Jo Kreitzer, founder and director of the Bakken Center for Spirituality and Healing. Mary Jo will be facilitating the Q&A segment, and we'll also share some more information about our presenter. But before I turn things over to Mary Jo, just a few logistical items I want to cover to help you navigate the webinar functions. You're welcome to share your thoughts and comments via the chat box. And if you are comfortable and want to share these comments with all participants, please make sure to update the to field in the chat box to all panelists and attendees. And then just note that you do have the opportunity to minimize that chat box during the presentation. And we invite for you to do that during the components that aren't interactive to help you remain present. There's also a Q&A icon where you can submit your questions, and Mary Jo will ask our presenter as many of your questions as we have time for at the end of the session. And I think we have some new people to our webinars today, so just note that your audio is automatically muted and your video is automatically turned off. We will send out an email post-webinar with links to recording of the webinar and also some other resources on acupressure later this afternoon. All right, I will now turn things over to Mary Jo.
Well, thank you very much, Molly, and good afternoon, everyone, and welcome to the Early Bakken Center for Spirituality and Healing webinar. I'm Mary Jo Kreitzer, the founder and director of the Bakken Center. And for 25 years, we've been advancing health and well-being in people, organizations, and communities. I want to acknowledge and thank all of our staff at the Bakken Center, especially Molly Buss, who masterfully manages all of the details of our webinar series. Acupressure is a powerful therapy. As part of traditional Chinese medicine, it is used to help manage many conditions, including nausea, stress, anxiety, and pain. While used by many healthcare professionals within healthcare settings, it can also be learned and used as part of self-care. And I think the response we had to this webinar is a powerful testimony that people are really interested in that. It's my pleasure to introduce our speaker, Kim Christensen. Kim is a licensed acupuncturist and a certified health coach in Minneapolis, Minnesota. She's the co-owner of Constellation Acupuncture and Healing Arts Clinic and on the faculty at Northwestern Health Sciences University. After earning her Master's of Oriental Medicine from Northwestern in 2015, she completed a 6-month pediatric integrative health fellowship at the University of Minnesota Masonic Children's Hospital and went on to study in Zhengzhou, China in the areas of pain, oncology, pediatrics, and Tuina massage. Kim has been published in Medical Acupuncture and Global Advances in Health and Medicine, and she's currently completing the doctorate of Acupuncture and Oriental Medicine, a program at Oregon College of Oriental Medicine, where she is specializing in complex and chronic illness, internal medicine, and gynecology. Kim is passionate about providing tools and education for self-care and strives to help people of all ages. We are so thrilled to have Kim with us today. She'll speak for about 45 minutes or so, and after that, I'm really looking forward to the Q&A. So with that, Kim, I'll turn it over to you.
Great. Thank you so much for that great introduction, Mary Jo. I am so happy to be here with all of you today, everyone from the University of Minnesota community, as well as all of the other community members that have joined us from all over the place. As Mary Jo mentioned, I think the incredible registration for today's event really is a testament to the fact that many of us are feeling like we need a little bit more to our self-care now than maybe what we needed 6 months ago or a year ago or 2 years ago. If you're like me, some of those things that you used to do may just not be cutting it anymore. You might need to learn some new skills, set a little more time aside for yourself. Just take a totally different approach. So I'm hoping today that you'll be able to leave this webinar with some new skills and feeling really nice and grounded. So, of course, we're gonna try to advance this. There we go. All right, so here is what we are going to cover for today. We're going to talk a little bit about the science and the impact of stress. We all know what stress feels like, but I really want you to be able to understand what's going on in your body when you're feeling that stress. We're going to do an introduction to acupressure. We're going to talk about specific acupressure points for stress management and how to use them. Then we're actually going to do a little guided acupressure and meditation together, and then there'll be time set aside for a Q&A. So let's dive in and talk about the science and the impact of stress. So as all of us know, practicing behaviors that reduce stress and promote calm really helps to improve our overall general health and well-being. We know that small actions can really make a big impact over time. It's really those small things that you do day to day that build up. But when things are tough, it can often be difficult to actually stay on top of these behaviors because we start getting distracted by all the things that are going on. I think this year for everyone has proposed like a new challenge to all of us to say, okay, how do we take care of ourselves? How do we tune in? How do we stay in our bodies and learn how to support ourselves so that we can best show up for our community members? Many of us are having to serve other people right now in ways that we've never had to do before. And so we all need to learn how to really care for ourselves. So first, we're going to do a little bit of a science lesson. We're going to talk about the basics of the autonomic nervous system. So there's so much going on in our nervous system. The autonomic nervous system really functions automatically. It's functioning right now. It's doing all kinds of things that you don't even have to think about. Things like managing your heart rate, your digestive function, your respiratory rate, your urinary function, all this stuff that your body just automatically knows how to do is managed by this autonomic nervous system. We're going to be focusing on two branches of it today that have a lot to do with our response to stress, to fear, as well as when we feel most relaxed, when we're most at ease. These branches are the sympathetic nervous system and the parasympathetic nervous system. So the sympathetic nervous system is really this alert and awake state. This developed out of a need for a protective mechanism for our body. The sympathetic nervous system is your friend because it activates when you're in danger, when you need to respond quickly. It's there to help protect you. It's what makes you be able to respond really quickly to needing to run away, or respond really quickly when you like knock a pitcher of water over and you just need to like wipe it up really fast. It's that sort of response that's driven by your sympathetic nervous system. This creates what is also known as the fight or flight response. So when this is happening, there's an increase in your stress hormones like cortisol, like adrenaline. There's an increase in your heart rate. So you notice your heart might beat a little bit more quickly. You start to breathe more shallow and more fast. Your muscles tighten and contract because this response allows you to move quickly, right? So it starts to basically get you ready to go. What's interesting is that it also shuts down some of the things that are very important, but not necessary for in the moment survival. Things like digestive function and immune system function. So when we're in this state of fight or flight, you can really see what happens, right? Things activate and some of these other things slow down a little bit. What's difficult is if we're in this state a lot of the time, that means that our digestive function is just like chronically low functioning. And our immune system function, which we all know is so incredibly important, especially right now, is also not going to function quite as strong because that bodily energy gets rechanneled somewhere else. Now let's talk about the parasympathetic nervous system. This is that rest digest state. Many of us have heard of this state as being that very calm, relaxed place. This is when you feel most at ease. Maybe you are on vacation. Maybe you're having a relaxing night with a loved one, just like watching movies or having dinner. Maybe you're doing an activity that you really, really enjoy and you just feel very, very calm and focused and in the moment. This is when your parasympathetic nervous system is very activated. This system is also most active when you're sleeping, when you're resting. This is when your heart rate is slowest, your respiratory rate is more slow, you're able to breathe more deeply and in a more relaxed fashion, your muscles relax, and your digestive system and your immune system function actually engage. This is when you're able to take in the food that you eat, get the nutrition from it that you need. This is when your immune system is able to kind of fight back against anything that might be invading. This is also when you get your best cell recovery and repair. So your body actually has the chance to heal itself. So as you can see, this is a state that is very, very restorative. It's important for you to be able to be in this state as much as you can. So neither of these are good or bad. Sometimes there's this idea that being in that sympathetic state is a bad thing. That's just not true. We need both of these systems to function. The trick is that they have to be able to balance each other out. They have to co-regulate. And as you can see from this diagram, there's sort of this wave, right? We need to be able to go back and forth between a sympathetic arousal and a parasympathetic restoration. This idea that this happens kind of in this gentle way where we easily go back and forth in this nice little wave is the idea of something that's called the zone of resilience or the window of tolerance. This is the idea that we're really hardwired to return to a state of regulation. And this zone of resilience or window of tolerance is this space where the system is able to re-regulate. The amount of stress is something that you're able to manage. It's something that you're able to just kind of move within with relative ease. The difficulty is that many of us spend far too much time outside of that window. Sometimes that happens because of one particularly traumatic or stressful event that can really dysregulate us. Sometimes it happens because there's several smaller stressful events that just keep happening. That window of tolerance becomes gradually smaller, and the size of that wave, the space where we go back and forth, becomes bigger. So when we're outside that zone, it's more difficult for our body to become self-regulated. If we become sort of stuck on in a sympathetic state where we just feel extremely tense, or we're kind of stuck off in that parasympathetic state where maybe we're a little checked out, kind of shut down, almost immobilized by the stress that we're feeling, there's a lot of negative health consequences that can really start to impact us. This can have to do with so many different things that we might experience in our past, in the present. And from what I observe with a lot of my patients, with many of the events that we've all been through collectively this year, many people are experiencing a lot of difficulty kind of re-regulating and finding that state of middle balance. So some of the symptoms of chronic stress and that experience of kind of being outside that zone are really, really varied. A lot of these might resonate with you as we're going through this list. So this can obviously affect us emotionally, intense emotions, mood swings, maybe aggression or impatience with yourself or with others. You might have racing thoughts, a lack of focus, forgetfulness. You might notice that your sleep has been impacted or that you feel incredibly fatigued during the day. You might experience physical symptoms such as agitation or twitching, maybe aches and pains or just worse muscle tension than usual. Headaches can also be a side effect of chronic stress in the way that it becomes somaticized, the way we hold on to that emotional experience and the way that our nervous system just responds. Because of the fact that immune system and digestive system function can be impacted, you might notice slowed healing of cuts, maybe frequent colds and flus. You just kind of catch everything that's going around. You might notice that your digestion gets really impacted in any number of ways. Maybe your appetite's a little lower. Maybe you want to emotionally eat. Maybe you notice changes in your bowel movements that can sometimes be really uncomfortable. This can definitely have to do with stress. I see this all the time in my clinic. You might also notice that metabolic changes happen. Maybe you have a difficult time losing weight or gaining weight, or you just feel like things are a little bit stuck and you just don't quite feel like yourself. You might also notice reproductive and sexual health concerns. And in general, chronic stress and a lot of the physiological impacts can really increase risk for heart disease. So over the long term, there's some very serious health consequences of ongoing stress. So of course, it's really easy to say, well, just manage your stress. We know that it's not always that simple. So I really like this 1, 2, 3, 4 approach to thinking about stress management. The first thing, of course, is to just observe. It's very easy in the busy world that we live in to spend a lot of time looking out here and to forget to actually turn our gaze inward and just notice what you're experiencing on the day-to-day in your body, your mind, and your spirit. If you take some time to observe that, you may notice that there's certain symptoms that you regularly experience during times of profound stress. You might notice that headache might get worse, or maybe you deal with some shoulder pain. Maybe you notice your digestion or your sleep. Whatever it is, start to observe what those patterns are, because that will start to tell you, oh, you know what? This is like a little alarm. Our body tells us these things because it's saying, hey, pay attention. There's something out of balance. Please take care of me, right? So it's a way for us to learn what our body is telling us. Once you notice what those symptoms are, it becomes easier to identify what those situations are that actually cause you that stress. For many people, transitions at a certain point in the day can sometimes be a really stressful thing. Maybe it's a certain meeting that you have or a conversation that you regularly need to have with a certain individual. Whatever those situations are, once you can identify them, it gives you a reason to know what's happening. That can be very empowering. It also gives you the opportunity to move on to that next stage, which is managing your response. So this is about learning what can you do in that moment to help reduce those symptoms. What can you do to manage the environment that you have, and really figure out how to set yourself up for success as best as possible. This is where we get also into the last stage, which is where you can prepare. And it's kind of like the prevention stage. It's figuring out what those things are day to day that allow you to enter these stressful situations more successfully, but also prevent them. I think about it in a lot of ways as like lowering that overall baseline stress level. So if you're constantly operating at like an 8 as your baseline, and there's a really stressful thing and it might like shoot you all the way up to like a 12 or a 15, that's pretty high, right? So if we can figure out how to move that baseline down to maybe like a 3, when that stressful event happens, maybe you're only up at a 7 or an 8. It makes it so much easier for you to be able to move through that successfully, knowing that you have started to do things that allow you to change the way that you actually respond in your mind, body, and spirit to a stressful event. So now that we've taken a little bit of time to review stress, let's talk about acupressure. So acupressure, as Mary Jo mentioned, is one of the many, many modalities of Chinese medicine. Chinese medicine is a very complex, full system of medicine with well over 3,000 years of history. It was developed in response to what the indigenous people of China were noticing in their life and in their health, doing early experiments, taking observations of nature and the body, and turning it into a really full, comprehensive system of medicine. Chinese classic texts are shown to discuss a wide range of health conditions that we still see today in modern medicine. All of this is really built on the fundamental understanding that there's a substance called qi flowing through the entire universe, right? Our health is dependent on qi flowing in an uninterrupted way through a complex system of meridians in the body. Now, sometimes it can be difficult to define qi. One way I like to think about it is really this dynamic, motive, vital force behind all actions in humans, nature, and the universe. So one example is, let's say you have the river. We're here in Minnesota. Let's say it's the Mississippi. The Mississippi is big. It's flowing. There's all kinds of water. We know that there's water in the Mississippi, but it's the qi that helps that water flow. It's that movement that's unseen that creates that system, that flow, all of that. So qi is everywhere. It's flowing through the Mississippi in the same way that it's flowing through our veins, helping our blood move. In the human body, we can also think about it as helping to pump the heart, it keeps us warm, it powers our thought, it does everything. So qi is tapped into in many different ways. One of the ways we can tap into the qi in the body is through acupoints. So there are thousands of acupoints across the human body. The primary system of meridians has approximately 361 acupoints located along those meridians. There's tons of points in other locations through other systems of acupuncture that have also developed through various geographical differences, familial differences, everything. So it's a very complex system of points, and you are going to learn a handful of them today. So when the flow of qi is disrupted, as we talked about, a person might start to experience unpleasant symptoms. Stimulating the acupoints helps to promote a balanced, smooth flow of qi to restore function, reduce symptoms, and improve health and overall well-being. What's interesting is that each acupoint has a very specific function based on its relationship to the meridian and the organ system. You'll see that the point names actually have the names of different organs in them. Acupoints also have functions based on the local anatomical region. So for example, a point on the hand will help the hand. And there's also other aspects of Chinese medicine theory that explain acupoints and how they function. So because of the fact that the body is connected via the meridians, it's almost like a net, right? That connects absolutely everything. So stimulating an acupoint on one part of the body is believed to create a modulating, healing impact on other body regions as well. You might notice as you're stimulating a point on yourself that you actually get sensation in a different part, maybe on your face, maybe on your leg. This happens all the time when people are receiving acupuncture. We believe as Chinese medicine practitioners that this is because the body is reinforcing those connections via stimulation of those acupoints. So acupressure uses the same acupoints as acupuncture. You can apply pressure with thumbs or fingers, elbows, or even special tools. You can perform it on oneself or on others, and it's very safe and effective and relatively easy to learn. What's really great is that by stimulating specific points on the body, we're able to reduce symptoms now. We're able to help promote calm, self-healing, and self-regulation. And we're able to prevent or reduce future symptoms. We know that acupressure, from a Chinese medicine point of view, helps to move the qi. From a biomedical point of view, we also know that it helps to increase blood circulation. There's a response in the local tissues in the area where that pressure is put. And it also helps to engage that parasympathetic nervous system. We're actually able to promote that shift into a rest digest space when we do acupressure. This is especially the case if you combine it with other self-care techniques like breathing, like meditation, other things that help you feel grounded. This is like supercharging your acupressure practice to make it even more relaxing and effective. So as Mary Jo mentioned earlier in her introduction, there are so many uses of acupressure. We're able to use it for various emotional concerns, headache, pain and tension anywhere in the body, insomnia, fatigue, digestive concerns, and reproductive health concerns. This by no means is an exhaustive list, but some of the common things that we often use it for. So now let's move into the section where we're actually going to be learning these points. So I encourage you to, get comfortable in your chair so that you can move around just a little bit. To begin with, we're just going to go over some of the basics so you understand kind of the format we're working with here. Except for points that are located on the midline of the body, which is this center line, all acupoints are bilateral. So if you're doing it on the left, you can absolutely do it on the right. When you apply pressure to your own skin, it's easiest to apply it with a thumb or a finger approximately at a 90-degree angle. So I'm just going to hold this up here, and you'll see as I come down, I'm coming in at about 90 degrees. This allows for a slightly better leverage. It's often a little bit more comfortable. And, when you do this, you want to do it with a firm, steady, and noticeable pressure, but you still want it to be comfortable. You don't just want to push super duper hard. This is not a no pain, no gain situation. Lighter pressure can sometimes be better, right? So increase the pressure gradually based on your comfort level. a Chinese medicine practitioner I really admire. Her name is Claudia Sitkovits. I was reading a text of hers and she mentioned that acupressure, it's not like a doorbell. Like you don't just push a button and it just goes like ding dong and then you're done, right? This is a little bit more subtle. And I loved that description because one of the things I always talk to people about is to actually observe what you notice in that tissue. If you're feeling a lot of resistance, just kind of sit with it for a minute and invite that resistance to fade, as opposed to just kind of like grinding on it and going in there. You actually have the opportunity to learn to work with your body to invite this healing response that you're initiating via acupressure. In addition to applying like steady pressure, you can also gently rub or massage the point. You can also tap it, which tends to be a little bit more invigorating. And in general, I recommend that people start with about 15 to 30 seconds and gradually increase to 1 to 2 minutes based on tolerance and what feels good to you. You can absolutely do it daily. And the one big safety note to know is that you want to avoid doing acupressure on areas of broken or blistered skin, any broken bones, bruising, wounds, or irritation. So let's start with our very first point. This is large intestine 4. I've also included the Chinese name here. One of the things I love about including the Chinese names is that they're often really illustrative of the location or the function. So this point is located on the hand, and through this, I'm going to be demoing myself. So make sure that you can adjust things in your own view to be able to see me as well as the presentation. So this point is located right here, as the illustration shows, on this top part of your hand between your thumb and your forefinger, kind of in this like meaty spot right in there. This is a headache point. It's great for pain, sinus congestion, anxiety. It's one of the most commonly used points. Many of you might already be familiar with it. So as you do this, what's often really easy is to just take one hand and kind of come over to your other hand, almost like a little pincher, just like that, and apply pressure with your thumb. You might notice that this spot feels pretty tender. All of us who are holding our cell phones all day, working on computer mouse, this muscle in there tends to get a little bit tight. So not only is this helpful for the uses that I shared here, but it's also really good if you're having hand pain or tension in that area of your thumb. If you haven't already, you can try the other side. And you might notice that one side feels a little bit more sensitive than the other. That is totally normal. One of the interesting things about this practice is that it starts to give you a little bit more information about what's actually going on in your body. Where are you holding tension? And if you're doing this and you notice any kind of radiation up your arm, anything like that, that is totally normal. So that is our first point, large intestine 4. The second point, pericardium 6, is located on the inner arm. So as I am demonstrating this point to you, I'm going to hold my arm up like this, but for you, it's going to be easier to find if you actually have like palm facing you. This point is commonly used for nausea, heartburn, anxiety, headache, dizziness. You'll notice that a lot of those symptoms are like things are rushing up when we want them to be going down. So this point actually helps to redirect the chi in the body in a downward kind of way, which makes it great for all of these things. This is a very, very useful point. Any of you who work in the hospital or maybe who have spent time in the hospital, you might be familiar with this point because it's commonly used for post-operative nausea. So to find it, what we're going to do, and again, you'll see I'm positioning my wrist like this. Right here is the wrist crease. You're going to take 3 fingers and place those 3 fingers right against that bottom edge of the wrist crease. Now, where that bottom edge of your 3rd finger is, that's the level that we're going to be at. Then what you can do is find the space between those tendons. You'll see I'm pushing right down into them, and there should be almost like a little crevasse in there. Go ahead and just sink your thumb into that space, and it'll feel like kind of a full, dull pressure. Again, sometimes this point can be a little sensitive, so adjust your pressure to make sure that it feels good to you. You might notice some radiation up into your palm or down into your arm. That is totally normal. This point is also really good for carpal tunnel. So if you're someone who actually gets some irritation in your arms or your wrists from overuse and inflammation in that area, this is also a great point for you. If you haven't, you can go ahead and try the other side. And this is just a great point to have in your toolbox. This point is called governing vessel 20. It's located at the very apex of your head. For any of you that are familiar with the chakra system or yoga practice or certain styles of meditation, you might actually be really familiar drawing your attention up here to the very top of your head, kind of like the lotus flower imagery. In many ways, this point serves a very similar function to that in more of a psycho-spiritual level. On a more physical level, we can really use it for headaches, for fatigue, for poor sleep. And it's just really easy to find. So what we're going to do is take our thumbs and position them right at the very tops of our ears, like that. And then we're going to bring our fingers together over the top of our head, almost like a headband. You'll see that my middle fingers are meeting right here at the very top of my head, and just palpate a little bit. You might feel a little bit of a depression or indentation right there on that midline on your skull. If you don't feel that depression, that's okay. This is the point governing vessel 20. I often love to massage this on my patients while they're resting. You can also apply pressure yourself, or my favorite thing to do is actually tap it. Anytime I'm feeling a little foggy headed, if I'm a little cloudy, I love to tap this because I feel like it just kind of re-energizes me. It like shakes the cobwebs loose in my brain, right? So this is something you can do if you're just feeling a little like, ugh, move it around up there by tapping or massaging governing vessel 20. Now, this point is called Yin Tong, also the Hall of Impression. Again, this is very much related to the third eye point for those of you that are familiar with the chakra system or have done various styles of meditation. This point is great for headaches, for anxiety and insomnia, for sinus congestion. It's extremely calming. I really enjoy massaging this point on myself, but again, also on my patients. And for all of us who are spending so much time on the computer, on our tablets, on our phones, kind of squinting at the screen, this is also a great point to help open up any tension that you might be holding in your brow area. So I'm going to take my glasses off so you can see it a little bit more easily. This point is located on the face right in between the inner edges of the two eyebrows. So what you're going to do is take either one finger, or my favorite, coming up like this and using both thumbs, and just apply a little bit of pressure to this point. If it feels good to you, you can also gently move your thumbs outward from this point, kind of massaging out that brow area. There's two other points actually located right here called urinary bladder 2. So if you do this, you actually get to stimulate both of them, which is great. So massaging this area can feel really, really soothing and relaxing. Another thing you can do, again, if you're feeling kind of foggy headed, you just need to get your thoughts really clear, is you can actually tap right there also. And sometimes that can feel like a very energizing kind of reset button for yourself. I find that young children actually really respond to this point as well. If they're feeling a little hyperactive, if they're having a difficult time calming down, if they're just feeling kind of upset, gently massaging this point is something that can be very calming and very soothing in children of all ages, from babies to, teenagers, if they'll let you massage their forehead. Another point, which is on the back of the head, is called Gallbladder 20. This point is great. We use it for a wide range of things: headaches, migraines, any sort of pain or irritation on the face, and of course, pain and tension of the neck, shoulders, and upper back. This is that point that kind of like hurts so good when you're getting a neck massage, right? So as you can see, it's located on the back of the head, inferior to the occiput, which is that bottom bone in your skull. So if you bring both of your hands behind you, as much as your shoulders will allow you to do so, you can either use your thumbs or your forefingers to find this. One easy way to find it is to actually come right to the middle, the base of your skull, over your spine, right over the top of your neck, and then gradually move your hands outward. And suddenly you're going to fall into kind of this soft depression on the back of your neck. This is between the sternocleidomastoid and the trapezius muscles. If you're not familiar with that anatomy, that's okay. Just feel for that big depression there. You might notice a lot of tension in that spot. If you're like me, you definitely have tension back there. So one way to massage this that I really, really enjoy is to actually thread your hands together like this and kind of do this motion with the heel of your hand right there on the back of your neck. You can just kind of massage it like that. If this doesn't feel quite right to you, that's totally okay. You can just bring your thumbs back here and massage, or your forefingers and massage this area. This is such an amazing spot in your neck because so many different muscle groups overlap there. So if you're able to bring a little bit of relief to this space and kind of engage relaxation there, it can do a lot to open up your jaw, your neck, your shoulders, all of that area. The next one is on the center of the chest. It's called conception vessel 17. I'm going to scoot back a little bit so it's easier to find. This is a point that is great for people who tend to feel a lot of chest tension or like tightness, heaviness in their chest, maybe shortness of breath. It's often used as well for cough or grief when things just feel really, really heavy in here. This point is located on the sternum. So one easy way to find it is to just bring one of your hands up to the center of your chest, find your breastbone here, your sternum, and just palpate downward. And it's right about in here. For some people, it'll be approximately at the nipple line. For other folks, sometimes that nipple line falls a little lower. So that's not always a great reference point. But you might notice that there's a little depression. This is approximately at the level of the fourth intercostal space. Basically, if you find the point that's a little bit most sensitive in there and it feels like a little depression, you got it. So what you can do with this point is apply steady pressure, or again, you can do gentle circular massage, or you can tap it. The tapping thing for me is something I really, really enjoy doing, particularly if things are just feeling a little tight in here. Sometimes I'll also combine that with just a little bit of gentle massage like this, just to open things up in my chest. With this point in particular, I really recommend checking in with your body and paying attention to where your breath is going. If you find that you're breathing really, really shallow in your chest, while massaging this point, invite that breath to come down more deeply in your diaphragm, into your belly, to fully open that chest space and use the power of your breath to regulate your nervous system and relieve some of those symptoms that you might be feeling. And the last point we're going to go over today is the point kidney 1. This is located right on the bottom of your foot. I'm not going to throw my foot up on the desk and show you this point today, but this diagram is really good and it shows you exactly where it is. So this point is located right below the ball of your foot. It's approximately a third of the way down your foot, like if you divide the base of your toes to your heel into thirds. And this point is great for grounding. Anytime you feel like you're just a little bit up in your head, maybe you have some dizziness, anxiety, insomnia, racing thoughts, headaches, and you just want to be grounded, this point is great. If you're not able to reach the bottom of your foot yourself, another option is to actually put something on the ground, like maybe a tennis or lacrosse ball or a small stone or something that just has a rounded edge, and actually just put your foot right on top of it to stimulate this point. I often use this point on my patients as well when they're in those early stages of relaxation with the needles in, or if they come in and they're just feeling quite anxious or upset, to just take a few moments and gently hold this point on the bottom of the feet while encouraging deep breathing. It can be incredibly soothing. This is also a point that works really well with children. If they're having a difficult time trying to rest, again, you can just do a little pressure on this point and it can be a very grounding activity. So self-acupressure not only helps to relieve these symptoms, it's an opportunity to give yourself time, attention, and care. And that is such an important thing. So often, many of us are functioning from empty cups, right? We need to make sure that our cup is full before we can share what's in that cup with other people. Acupressure on yourself is just one way to be able to check in and give yourself a little bit of time. I included a few ideas here for where you can actually incorporate acupressure into your own daily self-care plan. There's a lot of different options. You can use it in the moment for stress, anxiety, any of these symptoms. You can do it preventatively before events that might be causing a bit of stress for you. You can do it as part of a morning routine or a bedtime routine. Or if you're lying in bed experiencing insomnia, you can work your way through some of these points and focus on your breathing. If you have a meditation or prayer or breathwork practice, you can incorporate acupressure as part of that. You can also just do it if you're watching TV or sitting in a long Zoom meeting. you're sitting there, why not take a moment rather than scrolling on your phone to actually just check in with your body and do a little bit of acupressure in that way. And anytime you have a moment of stillness is a great time to actually do some acupressure on yourself. You can use these points just as a single point, or you can do them in combination. Whatever resonates most with you is what you should do. So now we're actually going to take a little bit of time and do a guided acupressure and meditation together for just a few minutes to give you the opportunity to practice these points as well as to get chilled out. So I am going to just adjust myself in my chair. I encourage you to do the same. Get yourself settled wherever it is that you are. You can put your feet flat on the floor. Allow your back to fully relax into the chair that you're seating in. You can place your hands on your lap and just take a minute. We just spent a lot of time learning, getting a whole bunch of new information. But now we're just going to shift. We're going to shift into a more embodied space, a quieter space, a space where you can allow your mind to clear. Just take a moment to observe as you're seated here, any tension that you might be experiencing. Just do a brief little scan. Notice your neck. Invite your shoulders to drop, your jaw to relax. Invite your low back and your belly to become soft. Your arms and legs heavy. Your hands relaxed. Your feet planted flat on the floor, heavy to the ground. Your breath slow and easy. Taking this as an opportunity to make your breath rate a little bit slower. Your breath a little bit deeper. Your exhale more complete, allowing you more space to bring in fresh oxygen with each and every breath. Now, as you're ready, just shift your attention to the point kidney 1 on the bottom of your feet. You don't need to actually apply pressure at this point. We're just going to bring our focus to it. Imagining that point fully fixed to the earth below you, providing a strong, steady foundation. The nourishment and abundance of the earth below you, providing a feeling of safety, of security. It's almost as if there's a root or a cord attaching your feet to the ground, going all the way into the center of the earth, providing you with that strength. And now shift your focus to the point governing vessel 20, right at the very top of your head. Again, we're just going to focus on this point and imagine a cord coming up from that point all the way up, 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 up into the sky above you, allowing your spine to lengthen just a little more. Sitting up straight, giving your lungs more space. your head lifted, and you floating right in this middle space, positioned between the sky and the earth, fully relaxed. You can now bring one or both of your hands up to yin tang, the point that's located right between your eyebrows. You can apply pressure at this point, continuing your cycle of breathing, inviting the tissues around the point yin tang to become relaxed, clearing your mind. Gently massaging out any of the resistance that you might feel there. And now, as you're ready, you can take your hands and either thread them together or use them separately and apply pressure to the point gallbladder 20, located right at the base of your skull. You can apply steady pressure to this point or gently massage it using the heel of your hand or your thumbs or your fingers. With each exhale, invite any of the tension, the worries, the fears, whatever might be coming up, to release if that feels safe to you and comfortable. Now take a final moment here at this point. Now take one of your hands and move it to chest center. Take a moment to connect with your breath in this space. Feel the rise and the fall of your chest. And as you're ready, use your fingers to find point conception vessel 17, located right in the center of your chest. Gently massage that point or apply steady pressure, inviting your chest to open. Inviting your lungs to become fully nourished. Any heartache or stress or tension that you might be feeling in this space to melt away. Now you can place your hands on your lap and bring one hand over to the other and find point large intestine 4, located right between the thumb and the forefinger. This point helps to relieve pain, helps to calm anxiety. It strongly moves chi. It helps regulate all the systems in your body. You can do the other side, inviting a bit of balance. You can now place your hands back on your lap and just take a moment to observe. Observe how your body feels. Observe anything that might feel different or shifted from when we started this exercise just a few minutes ago. And give yourself gratitude for making this time today to learn these new skills, to care for yourself. Gratitude for everyone who joined in on this call today to share in this moment. And gratitude for your body and everything that it does for you every single day. Now, as you're ready, you can wiggle your fingers and your toes, maybe gently move your head around, open your eyes if you close them, and just bring your attention back to the screen, to the webinar, and all the participants that we had here today. Now, we do have a little bit of time for a Q&A, so as all of you can kind of bring your focus back from the relaxed place, I know we have some questions that participants shared with us during this webinar today.
Well, Kim, I have to first of all say that was an incredible presentation and such a gifted presenter. I think you made us all relaxed just by the way you conveyed the information as well as the information. There are a ton of questions. And so I would say there's kind of two kinds of questions. One that asks questions about appropriateness of acupressure for certain conditions. And then there are other questions that ask about technique. And we have about 10 minutes, and I suggest we just power through them as fast as we can. Does that sound okay with you?
Perfect.
Okay, so first one, can acupressure help to reduce emotional eating urges, for example, sugar cravings?
Oh, that's such a good question. You know, I think in many ways it can, in that oftentimes emotional eating is really related to, various. It's so physiological, right? There's a real psychosomatic component to it. Oftentimes, some of those emotional pieces and the way that they really affect the physical body absolutely can. So I think that sometimes as part of a mindfulness practice, that can sometimes be really helpful with emotional eating, to be able to kind of bring things inward and say, okay, what's motivating me to do this? Why do I want to do this? Can I take a pause? What is going to be my action moving forward? Utilizing acupressure as part of that to kind of tap in, calm the nervous system, and provide that self-reflection can be really useful.
So Kim, there's so many comments as well in the chat and in the Q&A, thanking you for the amazing presentation.
Thank you.
This one comes from the School of Dentistry, and someone's asking, is acupressure, can it be helpful for managing fainting in dentistry?
That is a great question. You know, I have never clinically utilized acupressure for that specifically. However, I would imagine that many of your patients in the School of Dentistry are dealing with a little fear and anxiety as they're coming to their appointments. And so I think that acupressure could be a really interesting tool to help people feel more grounded and at ease as they're moving into that procedure. I think there would probably be a lot of potential there. Yeah.
So these are some technique questions. Do you press constantly for 1 to 2 minutes or intermittently?
That's also a great question. You know, there's not a right or wrong answer with that. If it feels comfortable to use constant pressure and you have a quantity of pressure that feels good to you, you can absolutely do constant pressure. If applying kind of more of a pulsing action feels better, you can do that. I'd say that pulsing or like tapping on a point tends to be a little bit more invigorating. So if things feel really stuck, applying some of that movement along with the pressure might help move things just a little bit more.
And so the next person asks, do you squeeze the opposite side or just the point when like doing the wrist and hand area?
Yeah, you know, you can do both. I'd say with large intestine 4, the point here on the hand, it can be really useful to actually come at it almost like you have little crab pinchers and just go on both sides. I'd say with pericardium 6 here on the wrist, what I often do is, as opposed to coming at it like a pincher, is to just keep my hands on the back side of my hand here flat, and to actually just apply pressure here with the thumb.
Mm-hmm. So there are a couple people that ask questions based on kind of some limitations they have. So somebody writes, I have arthritic thumbs, so it hurts to use them to press. Can fingers be used to create the pressure?
Yeah, you can absolutely use fingers. Another thing you can do, this isn't the best pen for it, but if you have a pen that has a nice rounded edge or some other sort of tool, you can absolutely, if it's easier for you with your hand mobility, actually just apply pressure like with this tool to that point and just make sure that the pressure, still feels good. You don't want to use anything sharp or pointy, obviously, because that could damage the skin, but anything with a rounded edge, if for some reason fingers don't work, or thumbs don't work, absolutely okay.
And so this next person writes, I have carpal tunnel syndrome. And when I did the first pressure point, I got tingling in my hand, which is one of my symptoms of carpal tunnel, which faded some, but after I released it, my fingertips were tingling. Is this normal?
Oh, that can be normal. It sounds uncomfortable. Sometimes if we have a compression of nerves or damage to nerves, or there's just something going on in the tissue where we're stimulating, sometimes it can aggravate that a little bit. So I guess I'd say for you, what might be a good idea if you want to experiment with this at home is to experiment with, where you're positioning it, as well as the amount of pressure, to just make sure that things are comfortable for you and that it's not actually aggravating your symptoms. The other option would be, of course, like for any of you, if you're doing this and you notice that it might be aggravating symptoms, you can always check with your doctor to make sure that it's appropriate to be doing acupressure, or visit a Chinese medicine provider and they'll be able to give you more customized recommendations based on your diagnosis and your assessment. Because of course, these are very generalized kind of blanket recommendations.
Mm. So for headaches, does it matter which arm to do the acupressure on?
Well, I tend to suggest that if it's possible for people and they have both limbs and they're able to do it on both sides, it doesn't necessarily matter which side you do it on. There are some schools of thought with acupuncture and acupressure to do same side or opposite side based on certain things. I would say whatever side works best for you and whatever side gives you the best results will ultimately be the best choice for you. But I'd suggest whenever possible, do it on both sides.
Okay. So the next person asks, and it's specific to headache. If you're using acupressure for headache, do you try to use all the points or stick with one and repeat? This person noticed that headache was listed really for almost all of the acupressure points. So how do you decide where do you begin? Which one to try first?
Yeah, that is a really good question. And one of the things that's interesting about this is from a Chinese medicine point of view, there's so many different diagnoses that explain headache, right? And certain points might be more effective for certain types of headache based on that specific Chinese medicine diagnosis. For you and any of you who are out there with headaches, I would say, you could, if you have time to do a sequence of all of them, do all of them, right? Like spend 5 minutes and kind of go through all of these, or 10 minutes. Otherwise, if you kind of want like a couple heavy hitters, like this one and the one back here tend to be really good for headache because it's both a distal point here on the hand, as well as one on the head itself. And just gently massaging your head can be helpful too. So again, it's sort of a non-answer answer of you can use all of them, or you could just use one of them depending on what you notice. But I'd say start with 2 or 3, see where it gets you, and you can always add or subtract.
How about pregnancy? Is acupressure safe to practice during pregnancy?
Acupressure is safe to practice during pregnancy. And I'm realizing that I should have on that one slide. So for large intestine 4, this is a point that's often not suggested when people are pregnant. Doing acupressure on it a couple times, it's going to be fine, right? But doing a daily acupressure practice all the time, utilizing large intestine 4, I would not suggest that just based on classic Chinese medicine theory. All of the other points that we have shared today in this presentation are absolutely safe, and acupressure can be a very effective tool in pregnancy for health and well-being, particularly pericardium 6 for nausea and any sort of morning sickness. Again, if someone's interested in utilizing acupressure in pregnancy, I really recommend visiting with a Chinese medicine provider to make sure that you are utilizing points that are appropriate for you based on where you're at in your pregnancy and the symptoms that you're having.
What's the difference between acupressure and reflexology?
That's also a great question. So, there's so many different systems of what we can consider acupressure. Acupressure is not unique just to Chinese medicine. So many different traditional systems of medicine from all around the world utilize manual pressure on points in the body to elicit a healing response, right? Reflexology is another system of acupressure that does have ties to Chinese medicine, but also other systems of medicine. And it's kind of based on the idea that you're almost like projecting the body onto like the foot, for example, and that by stimulating a point on the foot, you might stimulate the intestines or the lungs or something like that. So very similar, but just some slightly different theories in terms of why you might select to do pressure in certain areas.
Well, Kim, I think we could have a whole hour of just questions. There are so many wonderful questions that came in, but at this point, I need to make just a few closing comments, starting with thanking you again for this amazing presentation. Many of you have asked about resources, and we will be sending out a follow-up email that has some links to resources. And I also invite you to go to our website, Taking Charge of Your Health and Wellbeing. It's a free online resource viewed by almost 250,000 people monthly. It has many articles, videos about different ways to do self-care and explore acupressure as well as your own well-being. Additionally, we have a new website focused on cancer survivors and their caregivers, Taking Charge of Your Survivorship. It also has many features about acupressure, so we'll be sending you that link. If you're a health professional, you might want to consider enrolling in our academic course on acupressure. We're also working on an upcoming acupressure course on Coursera, and you can learn more about our integrative nursing and our integrative health and medicine specializations on the Coursera website. I want to thank you all for joining us today. And again, thank you to Kim Christensen for your amazing seminar. It was fantastic. So wishing you all a great rest of the day. Thanks so much. Bye-bye.
Thank you.